Have you ever heard a child repeating words or phrases like an echo? Maybe they keep saying, for an example, time for bed, even when it's not bedtime. This fascinating phenomenon is called echolalia. And trust me, it's more than repetition. So, welcome back to my YouTube channel. This is Next Level Teaching. Today I'm going to talk about a very specific topic which is called echolalia. Actually, echolalia is a speech pattern where a person repeats some words or phrases or sometimes even entire sentences which they have heard before. It's very common in young children as they learn to speak, but it can also be seen in individuals with autism, language delays, or neurological conditions. Yes, we need to go through two types of echolalia, which are immediate echolalia and delayed echolalia. Immediate echolalia happens when a person repeats what they heard just now. Like if you say, "Do you want ice cream?" Then they respond, "Ice cream." Or, "Do you want ice cream?" again. Then the second type is delayed echolalia. Delayed echolalia happens when a person repeats what they have heard earlier, maybe from a TV show or TV program, or one of his favorite cartoon maybe, or from a past conversation. Have you ever heard a child randomly say, "Fasten your seat belts"? Even when there's no car around them, they just say this. It might be because of a TV show what they have watched earlier. That is delayed echolalia in action. But wait, this echolalia means that a child is not learning? No, not at all. In fact, it is also a stepping stone for the meaningful speech. Many kids use echolalia to practice sentence structures as well as to understand interactions or to express their emotions. It is actually a helpful tool in language development. Some children use it to process information, build their vocabulary, or communicate in their own way. The key is understanding why they are repeating like this. Are they trying to interact with others? Are they trying to express emotions? Or just processing language? So, how can we support the children with echolalia? I will provide you 3 main effective strategies today. So the first one is, you can model correct responses. Instead of just repeating their words, just guide them, gently guide them. If they say, "Do you want juice?" instead of answering, you can say, "Yes, I want juice." Second way is, give them choices. Instead of asking open-ended questions like yes or no, you can try, "Do you want an apple or a banana?" So, then after that, they will learn to respond meaningfully. Third strategy is using visual cues. You can use pictures, gestures. Sometimes simple phrases can help them to bridge the gap between real communication and repetition. So, to reduce echolalia, you can use simple phrases. You can prompt correct responses. You should avoid asking questions from them. You don't want to be so arrogant with them or angry with them. So, if some students continue this echolalia practice after 3 years of age, then you need to meet them for a doctor. You need to take them for a doctor for medications. Remember, my audience, echolalia is not just an echo. It's a reminder of noticing that how someone's mind is working. Of course, with patience and right strategies, we can help them to build up these echoes into conversation patterns. Therefore, please keep listening and keep observing these type of students. These kids are everywhere with us. Sometimes you might have observed, sometimes in your classrooms, these types of kids might be there. So be vigilant about them. Don't make them angry. Just cooperate with them. Just help them to overcome this echolalia. So, if you found this video helpful, you can subscribe my YouTube channel, and also you can comment how you feel about echolalia and have you met someone like echolalia and what are the strategies that you have done for that person or the student. and please share and don't forget to like my video. Thanks for watching.